How you doing, man? My name is John Robinson from the ambulance. Your husband called because he said you're acting a little different. Okay, so we wanted to come by, check to see how you're feeling. All right. Before we start, can you tell me your full name? Ellen Page. Okay, Ellen. Miss Page. Can you answer me one more question? Can you tell me what year it is? 2020. Great. Mrs. Page was able to tell me her full name and her year, with no aphasia, no slurred speech. I'll ask her another question in a little bit, just to rule out any aphasia or slurred speech, but as of right now, she passed. All right, Miss Page, we're just gonna run a couple little more assessments on you, okay? Can you do me a big favor? Can you give me a nice big smile? Let me see those pearly whites. Okay, all right, patient was able to give me a full smile. She had no facial droop, positive facial symmetry, was able to give me a good smile. She passed that exam. All right, darling, I'm gonna have you squeeze my hands as hard as you possibly can, okay? All right, squeeze, 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 squeeze. All right, patient was able to squeeze my hands, equal grips, equal strength. I would probably ask her prior if she had any history of stroke, obviously, so I would be aware if she had any deficits, so that goes for the rest of the exam. If she had prior deficits on the right or left side, and the husband or herself couldn't tell me that she had any new deficits at this time. As of now, the patient has no deficits from a previous stroke. That was eight years ago, sir? 8 years ago. Okay, all right, ma'am, I'm gonna have you hold out your hands like you're holding out a pizza, okay? And as you're doing that, I want you to close your eyes. And I want you to do that for 5 to 6 seconds, okay? So hold out your arms, close your eyes. All right. So in this time, the patient would hold out her arms, close her eyes. If one arm were to fall down, she would fail that exam. If both were to fall down, usually because of weakness, she just can't hold her arms up, keep dropping them down. Mrs. Page was able to hold both arms up for 6 seconds, so she passed that test. All right, Miss Page, I just want you to tell a little sentence, a little phrase. You probably told your husband 100 times. You can't teach an old dog new tricks. All right. Patient was able to say that. No aphasia, no slurred speech. Said it perfectly. Passed that test. Next, we'll check her legs, see if she has a equal strength in her legs. All right, darling. Do you have any injury or anything like that on any of your legs that I should know about that might affect the strength of any of them? Negative? Okay. All right, darling. So I want you to push on your right leg as hard as you can, okay? All right. Can you push in this leg? All right. Push one more time. All right. Can you lift up your feet? All right. Patient is able to lift both feet. Has equal strength in both legs. Patient passed the exam. I would ask a couple other questions, like if she has ringing in her ears, blurred vision, check blood pressure, do a 12 lead, but as of right now, she passed her CV exam.